In the combat sports, concussions are almost inevitable. I mean, the point is literally to incapacitate the other person. The more I treat fighters, the more I realize that most of them have absolutely no idea what it takes to return safely back to training after sustaining a head injury. Now, your famous fighters in the UFC and other big organizations have teams of medical professionals to guide them back into training. But what about everybody else that trains MMA? I have seen very little education on what to do if somebody sustains a head injury during training or during an event. And even more importantly, you need to know how to spot a good clinician who's going to be in your corner and guide you back to training. How do they rule out something that's potentially life-threatening? How do they determine the severity of the head injury? How is it treated? How do I know when and how to return back to training safely? I'm going to answer all these questions and more while I take you through my most recent patient that I treated for a head injury. Okay, so a buddy of mine trains MMA and jiu-jitsu at my gym. I found out that he had sustained a head injury during boxing rounds when he fell backwards through the ropes and hit his head on the ground below the ring. Fortunately, the folks there at the time did the right thing, and I did a whole video breaking down exactly what to do immediately after someone sustains a head injury. So go check that out if you want to, but I'll briefly explain here. He had gone unconscious for a bit, but when he came to, they sat him up and they monitored his symptoms. They made sure he was oriented and that he was able to speak coherently. After a few hours, he felt good enough to drive home, where he took it easy for the rest of the day. The next day, he went to the doctor and got a CT scan, and thankfully they found no evidence of a bleed. After that, they gave him some general recommendations and scheduled a follow-up. And that's it. No tangible advice on how to return to training, how to properly manage his symptoms while at work, nothing. So I randomly ran into him at a Target a few days later. And once he told me what had happened and what his symptoms were, I told him that there were very specific ways to make sure that he returns to training safely. He had absolutely no idea that there were standardized protocols for this. So I agreed to evaluate him, and that's all you need to know for the backstory. So once a brain bleed has been ruled out and the athlete's condition is stabilized, the evaluation process for a concussion begins there. So let's dive into my evaluation process. But before we do, start sending your questions to my Instagram at @CombatAthletePhysio, my email at combatathletiphysio@gmail.com. I'm going to start answering your questions in video format. Since I'm getting some really good questions that keep popping up, it's easier for me to answer on video format rather than reply to several of you with the same response. Okay, so the first part of the evaluation is a medical history and then a cognitive and symptom assessment. This is where I conducted a thorough review of his medical history. While we were talking, I made sure there were no severe cognitive impairments, inquired a bit more about the mechanism of injury, and established the severity and irritability of his symptoms. And this all helps establish a baseline for the objective portion of the evaluation. Now, the second part is the movement exam. This is where I take a look at the quality of movement in his thoracic and his cervical spine. More often than not with head injuries, the cervical spine is implicated. We assess his range of motion, how the muscles feel to palpation, and how well the cervical joints move with pressure. And then we take note of what does or what does not reproduce symptoms. Fortunately, throughout this portion, he only had mild pain in his neck that did not reproduce or coincide with his headaches, telling me that the headaches were probably more related to his eye fatigue at work, rather than cervicogenic in nature, or originating from the neck. Next is the neurological examination. This is a comprehensive assessment of neurological function, where I evaluate cranial nerves, reflexes, coordination, strength, sensation, and balance. This allowed me to identify any abnormalities or deficits. I really wasn't worried about him having significant findings here, given his negative imaging and his ability to carry out everyday and work-related functions without any issue. But we still need to be thorough. Next is the visual examination. The visual impairments can occur following a concussion, so I took him through a thorough evaluation of visual acuity to discern whether this was a significant contributor to his symptoms. Visual tracking was smooth and of good quality. However, when we tested saccades, or quick eye movements, these began to bring on a mild headache. The symptoms quickly subsided, but this tells us something really important about his headaches. You'll see in the next section that we're going to start loading him aerobically. However, now we know we have to include some education at the end of the evaluation on how to balance his exercise program with his eye fatigue. And the final portion is aerobic loading. The first step with return to sport is to establish a baseline of exertion and symptom onset. The Buffalo Concussion Treadmill test is what I typically use, given its established efficacy in the literature. This test establishes a heart rate at which exercise-induced symptoms occur after a concussion. And then, using these findings, you establish a program based off of a certain percentage of that heart rate. I'm not going to go into the ins and outs of the Buffalo Concussion Treadmill test, and the reason why is because some of you will undoubtedly try to do this yourself. And this is absolutely not to be done without the supervision of a clinician. The purpose of this video is to show you what a good clinician should be doing for you if you or someone you know has sustained a concussion. Alright, these are the findings of the evaluation. To summarize, we found a baseline heart rate that increased his symptoms to the point where the test needed to be stopped. He had some lingering sensitivity to light and screens during the day since he works a desk job primarily, so we had to manage that. He also had a small headache for most of the day, so we educated a little bit on how to manage those symptoms as well. He didn't have any neurological findings at this point, and the only visual testing that lightly reproduced symptoms were saccades. So my buddy's initial program looked something like this. Luckily, he's young, he's healthy, and his symptoms weren't too severe, so we were able to load him aerobically right away. Every day, he did 1 to 2 bouts of 20 minutes of uphill walking, keeping his heart rate at about 130 beats per minute while monitoring his symptoms for the entire bout. And after a couple of weeks, he and I did some light rolling without any symptom reproduction in his neck or his headaches. And he also didn't have any more headaches at work. So at 3 weeks, he did some light sparring, taking only shots to the body. After that, he actually went on vacation for about a month. This allowed him to rest up even further and allow his eye fatigue to completely settle down. Once he came back, he was able to ease right back into boxing, and he was full sparring in no time. That puts him in about an 8-week return back to full sparring. And I just want to add that had his symptoms been more severe, like if he had a lot of sensitivity to light or if his heart rate spiked immediately in the beginning of the test, we would have had to make a program with much different parameters and potentially even wait until his symptoms improved more before we could load him, all based on the individual in front of you. Also, if he had presented with any symptoms that were more directly related to his eye movement, we could have given him specific exercises for those as well. All in all, if you're sitting in front of a clinician and they don't do anything remotely close to this, or they don't refer you to somebody who does, please make sure you find one that does. A broken bone or a torn ligament is one thing, but you literally cannot afford to take head injuries lightly. If you have any questions about any of this at all, please do not hesitate to reach out to me. Again, my Instagram is @CombatAthletePhysio, and my email is combatathletephysio@gmail.com. Thank you guys for watching, and I'll see you next time.